In this video, we're going to show you the basic cortical mastoidectomy. The indications for this procedure include drainage of acute coalescent mastoiditis, cholesteatoma surgery, both canal wall up and down, or as the initial part of another more complex procedure, for example, cochlear implantation or translabyrinthine approach for acoustic neuroma. Here you can see the left temporal bone in the surgical position. To begin, select a large size cutting burr, typically 5 or 6 mm. This ensures fast, efficient bone removal to progress the dissection quickly without tiring you out, thereby reserving time and energy for the more delicate, deeper dissection. When drilling, try to use the equator of the burr as opposed to the poles, because the equator is where the blades of the burr are deepest and moving the fastest, thereby removing the greatest volume of bone per unit time. Begin your drilling just posterior to the spine of Henle and drill backwards along the temporal line towards the synodural angle region, parallel to the middle fossa dura. This will ultimately define the superior boundary of your dissection. A second cut in the bone is now made posterior and parallel to the ear canal wall, going downward towards the mastoid tip. Now, the intervening cortical bone is systematically removed to expose the air cells underneath. Posteriorly, the boundary of your mastoidectomy cavity roughly follows the course of the sigmoid sinus. The deepest part of your dissection should always be high and anterior, because this is the location of the mastoid antrum. The aim of cortical mastoidectomy is to reach the antrum, because this is the gateway to safely finding all of your other temporal bone anatomy. Note here that at a certain point, the mastoid air cells give way to a sheet of solid bone. To the inexperienced observer, this might be confused with the medial wall of the antrum. In fact, this bony sheet represents the Kerner's septum, also known as the petrosquamous lamina, which separates the petrous air cells from the squamous ones. This has to be drilled through in order to finally arrive at the antrum. If you're unsure or concerned that you may be too deep and at risk of drilling into the lateral canal and not the Kerner's septum, it can be helpful for you to triangulate your depth by looking down the ear canal at the eardrum. If the bone you are planning to drill is lateral to the eardrum, then it's likely to be Kerner's septum. If, however, the bone is at the level or medial to the eardrum, then stop drilling. Here we can see the drill breaking through Kerner's septum into the antrum. Here now are the three boundaries of your cortical mastoidectomy. Superiorly is the bone covering the tegmen. Posteriorly is the bone covering the sigmoid sinus. And anteriorly is the bone of the posterior ear canal. In the medial wall of the antrum, you can make out the curve of the lateral semicircular canal protruding outwards. This completes the basic cortical mastoidectomy. And now it's your turn. For the exercise, you should perform a cortical mastoidectomy on 5 left and 5 right temporal bones. As you do so, you should appreciate how you need to hold the drill in order to achieve the desired result in each case. You should also appreciate the different ways that you need to rotate the temporal bones in order to gain better access and the best views when drilling. This movement of the specimen is analogous to the movements you will perform in theatre when positioning your microscope, the patient's head, and also the operating table during different parts of the operation.